I want you all to know that we've been talking a lot about we want to build the best Social X house out there. Because if we build the best Social X house, everybody's going to want to come live in it. And we have done an incredible job on this house. You notice there's a bunch of things in it, and then there's three things at the bottom that are coming soon. So for those of you that are brand new, I know there's brand new people on here tonight. I want you to know one of the rooms in the house is our literal nutritional products and everything. Two of them have helped me lose a bunch of weight. Three of them are life changing. They go through the soft tissue of your mouth into your body, total body nutrition, total cell health in like 4 seconds. Within 2 minutes, they hit all the organs in your body. That's Howie Mandel there holding our Exhilarate product. It was amazing what happened with all that. And we are literally shipping these products all over America, Canada, Mexico, Europe, and soon the world. That's just one room in the house. Then the next room that we added not that long ago is our personal care room. There's things in here like that citrus silk skin lotion. It's a serum. You will not believe it. It competes with $150 an ounce products, and it actually does a better job. Only here, it's double the amount for less than half the price, right? And it's incredible. We've got the mouthwash, and then the one I just want to talk about real quick, the toothpaste. Read the warning label on your toothpaste when we're off this webinar tonight. Don't do it right now, but after you watch this, go read it, and you're going to notice that it says, if too much is swallowed, call the Poison Control Center right away. Folks, I can't believe I've been brushing my teeth with that my whole life and never read the label. Here's what I know for sure. Our toothpaste is the opposite. You're supposed to brush your teeth and swallow it because then it creates good gut health. So you don't want something that if you swallow too much, it's poison, right? So the personal care room in the house. Then we've got our financial freedom room in the house. We've got such an incredible compensation plan, everybody. I was able to get it copyrighted. Nobody can copy. We've already produced millionaires with it, and it's incredible what this is doing for families all over the world. One of the most unique special rooms in the house is our Newcom room. Social X partnered up with a company called Newcom. It helps you go to sleep, feel better, have more energy. Imagine going to sleep without having to take any drugs to do it. They're coining this the digital sleeping pill. 2.7 million surgeries have been done without anesthesia, instead using this technology. It's one of the most amazing rooms in the house. Then, of course, we've got our brand new Social X app. It was coming soon until last Saturday, so this isn't coming soon. 33 cents a day. You can use this to have every tool you need to build a complete global business. Then we've got an incredible new room. It's to help you with your health plan in America. This room is for people in America. They can get the product, but anywhere you live in the world that you're in Social X, you can share this with people in America and make money off of the product. Okay, so it's really for everyone, but people in America can get it. And see how it says coming soon? Guess what? Now is the coming soon. Okay, so then the final room in the house for now is our Social X University, where we're going to teach people and train people in all areas of life to have better marriages, better finances, just all kinds of stuff. And tonight, I don't want to steal the thunder from a different room in the house, so I'm not going to explain all about this right now. It is coming soon, hopefully within about 30 days or less. But folks, what I want you to know is, see the bottom three rooms in this house. Two of them are coming soon. After this webinar, now two of them are here. Okay, and so we're going to be down to the one last room that we're completing over about the next 30 days. We're here to talk about the health plan room. That's why we're here right now. So with that being said, Jay, I really, really, really appreciate your patience. I just wanted people to understand we are blowing this house up in the best way ever. And it's not even a house anymore. It's a mansion now. It can create financial freedom, better health, just a better quality of life, right? Well, one of the things that has been plaguing America is healthcare. It's crazy what's been going on. And I don't want to steal any of Jay's thunder right now. So Jay, I am going to turn it over to you, but I just want to say publicly, and I'll be here till the end. And folks, make sure you stay on, because you're going to be able to make money off everything Jay is about to talk about, okay? So make sure you stay on to the end, and we'll talk about that a little bit, and we'll tell you how you can get started with this. But the main thing I want you all to know, this truly came from a heart that cares. Jay's. When he told me the story of why he started doing this and why he got involved, this isn't even what he does. And now it's a major part of his life. So, Jay, with that lead in, I'm going to let you share the actual story, but I just want people to know we appreciate how much you care and we're going to make a difference together like no one's seen before. So, go ahead.
Thank you so much, Stu. I can't tell you how much I appreciate that. And your team, I have to be honest with you, I have been absolutely blown away. Like Stu said, we came down to the wire, making changes, improvements. I've just been blown away by your team, your passion, and your energy. The energy is incredible. So I'm gonna go ahead and share my screen. Let me send my request.
You're good to go, sir.
Fantastic. All right, guys. As Stu was saying, it's kind of interesting how we ended up here, how I ended up here in particular. When I met Stu originally, we were working on a different program, a different product, and I had a client on our law firm. And I guess maybe I should even introduce myself. My name is Jay Godwin. I own a company called Fierce Law Group, and part of what our law group does is we assist companies with management or changes, the things that they need to change or address. So I had been working with Stu on a different product, and one of our clients at the law firm had a product that they had already launched, and you guys were already selling it, doing very well with it. That product was basically meant to be like a overlay product. If somebody already has health insurance, or maybe somebody that doesn't have health insurance, it was a good answer to kind of give them a little bit of assistance. Well, we started doing contractual work for this client. The more that I paid attention, the more I wanted to get involved. Finally, we saw that maybe they could use a little bit of assistance. So we came alongside them and finally believed in it so much, got so excited about it that we asked if we could take it over and if we could bring the rest of the product home. And that's what happened. So we take you back now till right about November. We were, again, working very closely with Stu and his team, and we started to hear an awful lot about changes that were coming in healthcare. And we hear stuff like this all the time. And I want to start by saying, guys, this is absolutely not, I'm not going to talk politics, but you're going to hear the name Obamacare quite a bit because that's one of the changes that was being made. So there are subsidies that were set aside for American citizens to help them better afford health plans. Well, going from November into December, we began to hear more that the subsidies were in fact going away. And I heard that originally and I thought, well, it's going to get a little more expensive. That stinks, but we're going to be okay. We still got a lot to work on. Well, right about that time, I had one of our administrators came in to me. This is Carolyn. Carolyn is one of our administrators at the law firm. And she said, listen, did you hear anything about these subsidies, the Obamacare subsidies going away? And I said, yeah, we've heard quite a bit about it. Why do you ask? Well, Carolyn's healthcare plan was monthly premium on her plan was $267 a month. Her subsidies were removed. So she was instructed at that point to go straight to the marketplace website, which she did, and she began to search for her new insurance policy. Well, when her insurance policy came back, it came back at $1,945 a month for her alone. They worked and worked and worked, and at one point, I believe they got it down to somewhere in the neighborhood of 1,600 a month for one person, and it just wasn't affordable for her. And this was so close to home, it struck me so hard that I said, "Wait a minute, we've got to make some drastic changes here. We really need to do something about this. Now, you guys will probably see and hear Carolyn the more time that we spend together. But I do want you to know as we leave her for now, we were able to take her and with the social health product, we now have her with full coverage health plan, and she's at 715 a month. So keep in mind, from 267 to $1,945 and now at a comfortable $715 a month. That's an amazing ride, and she's happy as she can possibly be now. So what we're going to be talking about is the social health product. This product is meant to be, again, it morphed into so much more than we had initially intended. This product, once we understood what we were up against, we said, we've got to create something that's going to go head to head with the marketplace. We stand and looked around and we saw that everything had changed. So we were talking about 27 million Americans are now uninsured. 27 million. Now, the ACA subsidies are expired. There are transparency. There are some that are still left in the marketplace, but they are going away. So about 95% of the subsidies have vanished. So the premiums before the subsidies, the premiums were estimated to go up 26% in 2006. So it was already going to get more expensive. Then the subsidies expired, compounds the problems. So it is a drastic problem with drastic changes. We believe that the social health product is the answer. So again, let's talk about exactly where we are. We're talking about 27.1 million Americans are uninsured. Now, the average family on an employer plan, their part was running about $26,993 a year. Okay. That's somebody who was fortunate enough to get on a family plan through their employer. So then they estimated that there were 3.8 million people that were going to lose coverage in 26. So now we're talking about 30 million Americans are without coverage. The premiums went up 114% from where they were. Then you have insured Americans who had to have something. They were buying catastrophic care at catastrophic pricing with ridiculous out-of-pocket money and deductibles that were just unreachable. So 41% of the Americans that did have insurance were significantly underinsured. And then 63% of the folks that did not have coverage at the end of the storm said that it was all about the cost of that insurance. So if we take a look at the collapse completely, I think it's important to notice that the average premiums, and this comes straight from the marketplace, the average premiums went from $888 for a family to $1,904. So you're talking about a 114% increase, 3.8 million more people, 10.9 million are estimated to still lose coverage. So we're going in the wrong direction. Well, I want to introduce you to another type of a situation that people are dealing with. We have an awful lot of people who we said can't afford coverage. Well, I want to introduce you to Martin and Danny. Martin and Danny, quite honestly, complete transparency, was the first health plan that I actually helped put together myself. So I'm extremely proud of this. Martin himself was leaving a 25-year career to chase what he considered to be the American dream, which is self-employment. I'm not sure if I agree with him on that anymore, but he was excited to do it. But they had to make a hard decision. After leaving his employer of 25 years, they came to the conclusion that they weren't going to be able to afford health care any longer. So, like a huge number of Americans that we've talked about, they just accepted that it's not going to work that way. Well, a lot of you who do know me know that one of the main things that I do is financial services and credit restoration. And the minute that Martin told me this, the first thing that popped into my head is when looking at folks' credit reports, the number two reason for financial and credit devastation is medical. So Martin and Danny were truly gambling with their future. Well, with the same social health program, we were able to get them coverage for $1,134 a month. So now he is self-employed. Business is rocking and rolling, you'll be happy to know, and they're fully protected. That's about as close to the American dream as you could want. So again, we had to take and break the norm. We had to go head to head with the healthcare system and break that wall down. It was not an easy thing to do. When looking at why people aren't insured, again, 63% of Americans say they can't afford it. Then you have 20% that say that their employer doesn't offer it. You have 10% that are just ineligible. But who are we talking about? Well, the Hispanic population, for one. So 24.6% of adult Hispanic Americans are uninsured. Of young adults, we all believe, well, I can't say we anymore. I'm not a young adult any longer. But young adults at that age, we feel that we're invincible and that we may be okay not having coverage. But remember what I said. We're one step away from a catastrophic medical injury, which financially devastates everybody. So the state that has the highest percentage of uninsured is Texas, with 16.7% of the population absolutely uninsured. Huge risk, and a risk that we no longer need to take. So the social health program is actually based on two different levels of service. And we believe that this program will actually meet any consumer where they are and give them what they need. Period. We have plans starting at $79.97 a month. We have virtual care, we have in-person care. We have a product that wraps the both of those together. Then we even have a much larger plan that we call a plus plan, and that's a share plan. But I want you to take a look at the core products. Now keep in mind, these are just the core product pricing. It starts at $79.97 a month. So again, significantly more affordable than what a lot of people were attempting to wrestle with before this. Now, let's take a closer look at each one of these products. Now, the silver is where we begin. This was actually the product that you guys started with. This product was designed to not necessarily be a standalone, but to be an overlay product that to give an extra layer of protection for folks and even a little bit of comfort for those that do not have insurance at all. So the Silver program is based off of 24-hour day virtual urgent care. Now, the virtual urgent care, it's very important that I point out to you that typically a consumer can end up on a Zoom with their care provider and within an hour. Now, I believe that in going through this, Stu has a story that he'll touch on at the end with his daughter had her own experience with a virtual care request. And if I'm not mistaken, it was even significantly faster than an hour. So again, we start with the virtual care. Now, along with that, there are 27,000 free medications. That's right. I said that free medications. That means that it's not a discount card. It's not a prescription plan where you get specific packages and get discounts. These are actual free medications, 27,000, and they can even deliver those to the home for free, literally for free. So again, just to wrap up, we've got the 24-hour a day, 7-day a week virtual care, virtual primary care, 27,000 free medications, mental health support, chronic disease management, and free home delivery for those medications. Then we step to the Gold Core product. Now, the Gold Core product is where we begin to be what they call ACA MEC compliant. MEC is nothing more than a mandatory coverage. Now, you guys remember at tax time, there were penalties for those that did not have the minimum essential coverage. I don't even remember what the penalty was. Well, this removes that for you. So you're not going to have a penalty. And this is where we get into the in-person page. Now, zero preventative visits. You're going to hear me talk an awful lot about that. We believe that preventative care is the way to go. Why try and afford it after the fact if you could have prevented it from the beginning? Knowing what I know about Social X now, an awful lot of what you do is preventative anyway. The products that you have are absolutely fantastic tools for preventative medicine. But we have several other items that are free of charge, and I'm going to go into that more in just a minute. Now, there are primary care physicians and or specialist visits, which are simply $25 a piece per visit. Then you have labs and x-rays that are $50. Now, guys, there's no charge after that. There is no after cost expense, no cash out of pocket expense. That's it. It's $50 labs, $50 x-rays. The in-person PPO network that this is built on happens to be the largest PPO network in the country with over 1.2 million providers. And that grows every single day. We talked to a couple of leaders in your organization that were shopping our program just to see exactly how good we were. And a couple of them showed us their chat GPT searches where this PPO network actually came up as the number one network in the country. If chat GPT loves us, well, that says a lot. Again, this is ACA Met compliant, the Affordable Care Act. So this covers you when it comes tax time. And the PPO plan is nationwide. Now, there's an extra formulary, which means that there are more prescriptions that are free, literally more that are free. Now, there's a little bit of overlap in them, but there are some medications in the gold formulary that are not available in the silver. So it covers even more. And I believe we're coming up on 7,000 of those in that particular formulary. So we're talking well over 30,000 medications that are free. Then we step in one more time to the platinum coverage. The platinum coverage is the best of both worlds. You get both the silver benefits and the gold benefits. So you get the primary, you get the in-person, you get the 27,000 free medications with the extra almost 7,000 medications. You get the zero cost virtual care appointments. And by the way, no restriction on how many of those appointments you have. Then you get I believe we mentioned a $25 primary care, primary physician appointments. This really truly gives you the best of both worlds. Now, taking it from there, this was one of the moments that really shook me and kind of took the wool over my eyes, so to speak, showed me what was really going on back in December when I understood exactly what was removed. Looking at the products that I just showed you, they're fantastic. Day to day, it is absolutely the best way to approach healthcare. With the virtual, I was a single father for many years with two little boys. I wish I had had the virtual care because as a single father, you have one that gets sick. Well, you've got to pick him up, grab the other one, go to the doctor, sit in the waiting room with a bunch of other kids with snotty noses. So if the other one wasn't sick, he's going to be now. It was brutal. I mean, now we could simply do one of the virtual appointments. We got like I said, the in-person appointments covered. But what happens beyond that? What about hospitalization? What about ER visits, surgery, maternity? These things we had no answer for. Remember that slide where we went back and we're breaking down that wall? That's where this came from. We have actually added another level that we call the plus level. The plus level gives us the ability to go head to head with the marketplace. Now, hear me on this one. With the plus products, you actually have three levels of deductible that you can choose. 1,200, 2,500, or 5,000. Now, guys, of course, when you're talking about the different levels, it's going to adjust the monthly commitment that you have. But remember when I told you about the preventative care? There is a huge list of preventative care items. Things like, for people my age, colonoscopies. There's cancer screenings. There's a bunch, and I'm going to show you more on that in just a minute. Then you have coverage for major medical events. So if you do end up in the hospital, you do end up having to have surgery. It truly covers the rest of the way home. And it's built on what's called a shared plan. So that means that a community of people have gotten together on a national level and they share the expenses in this plan, which makes the whole thing work. And quite honestly, it blew me away when I finally understood what this means. Now, no network restrictions. How many times have you run into that before where you're beating your head against the fact that somebody's out of network? No lifetime maximums. That's crucial. And we're going to come into that. In fact, we talked to, again, a couple of your leaders early on that told us the stories of what happened after the deductible was paid. There was still more. Well, guys, there is no lifetime maximum that's going to give you that more at the end of this. Now, there's a three deductible cap. So the deductibles that are paid per incident. So if I had one of my boys that broke his arm, well, that's one deductible. So that means that that uninsurable portion would be the 2,500 because we happen to be on a 2,500 program. Well, if he turned around then and broke the other ones, there would be a deductible and a spanking because he broke the other one's arm now. But again, you're capped on those deductibles for three times a year. Now, anything that happens with those instances. So, for example, if Kyler with his broken arm had to have appointments after the fact, that 1,500 is it. Or I'm sorry, 2,500 is it. There's nothing else that you're going to be charged for. If they have to come back in and do extra x-rays, if they decide, well, it didn't heal right, there's surgery, that's it. You're capped at that 2,500. Now, pre-existing conditions. Guys, this one is crucial. Pay attention to this. On pre-existing conditions, that typically causes huge problems when looking for protection through this type of coverage. Well, we have the ability for folks to begin coverage within a year. So literally in the first year, we can begin to phase them in. But I want to point something out to you. An awful lot of the care that people need for these pre-existing conditions are actually covered through our Gold Core plan. Now, I know I'm throwing a lot at you guys, and I know it gets a little bit confusing, and we're going to give you guys the ability to speak to a licensed professional that's going to help you make the decisions that are best for you. So I'm throwing a lot at you just to give you as much information as I can at one time. But if you have a pre-existing condition, we're going to work with you on that and still find a way to get you coverage. There's also, it's interesting to point out that there are some pre-existing conditions like high blood pressure, like diabetes. Well, we have exclusions on those. So for high blood pressure, diabetes, and a couple of others, you actually are included on the share plan. So you do not have to wait to have that addressed. Now, this business, this whole entire program was built on a customer service platform that is absolutely second to none. When Stu and I sat down and we talked about the product offering initially, he said, "Do you think that you could build this what it needs to be?" And complete transparency, I said, "Stu, I don't know. Let me step back. Let me go back and look at this." We took everything back to the law firm and I said, "Guys, this product, the customer service that has to go with this product is significantly higher than we've done in the past. We do an awful lot of financial advising. We do an awful lot with mortgages, things of that nature. But when you're talking about healthcare, you need customer service that goes significantly deeper and can be on the phone for significantly longer. So we had to find a platform that would house all of this and offer everyone the top tier white glove Chick-fil-A type of customer service. Well, we found that and we were able to build on their back. So now this customer service creation is actually yours. It's literally the social health customer service, meaning there's a customer service that you can reach by phone. And of course, when they answer the phone, they're saying, social health, how can we help you? There is live chats that you can have extended conversations by live chat if you so choose. Then if you decide during the live chat that you want to go straight to a phone call, you can do that as well. So this program itself was built before the product. So the product with this portion of it literally came after. They built the customer service and then came the product. Now, notice down at the bottom, the 800 number. You guys might want to take note of that number. We're going to show it to you here, but we're also going to show it to you again in a few minutes. That is the direct number for the Social Health Support Center. Guys, this can give you anything you need to know. So, as a social health agent or associate, if you're wondering, how do I enroll somebody? Guess what? You call your hotline. Guys, I need help. What do I do? Guys, I had a question about this. How do we address this? Or listen, I've got mine. I need to know which card I use for what. Boom, you call them. They walk you through anything, whether it's for your own product, to help a customer of yours, whatever the case may be. Remember when I told you they meet you where you are and take you where you need to go. That's what this was built on. When I came back to Stu, it was this portion right here that made me come back and say, yes, we can do this and we can do it better than it's ever been done. I'm going to talk more about this in just a minute, and we're going to talk about that 800 number just a little bit more. But I want to show you how we stack up to the competition that's in the marketplace now. I'm getting a little excited with the arrows there. So at the moment when you are looking at our product versus everything else, let me move this. For the plan type, remember we talked about the MEC, the minimum essential coverage, all right? With ours, there is no faith requirement. With the one share from Classic Crown, which is our largest competitor, there is a faith-based statement that has to be made. Now, with the Affordable Care Act insurance, there is none. Pre-existing conditions. There is no exclusion on the MEC plan. Remember we talked about the Gold Core plan? The MEC plan is the Gold Core plan. There are no exclusions. And then on the sharing plan, which is a plan with the deductibles, there are phase-in periods. You can begin to enjoy participating in that within the first year. On the one share Classic Crown, it was a 24-month wait. ACA, no exclusions. Lifetime max, there is no lifetime max on eligible expenses with the social health plan. Now, on Classic Crown, I believe that is capped at $1 million. ACA, no limit. PCP, which is primary care physician, unlimited visits. Unlimited visits, $25 in person and zero cost for the virtual. And you can do that, like we said, within an hour. Well, with Classic Crown, you're limited to 5 visits per year. I don't know about you guys, but with 2 little boys, we do a whole lot more than 5 visits a year. ACA, everything is done on co-payment and it's limited visits. Virtual and telehealth, again, $0, unlimited primary care and mental health. For Classic Crown, it's acute only with no virtual behavior available. ACA, it varies from plan to plan. Prescription coverage, this is where we really stand out because remember, we're talking about the 27,000 free. And there's also a tiered for some of them that are beyond the 27,000. So even some of the more boutique type medications, the more expensive ones, you're able to get those anywhere from $15 to $75. And keep in mind also, there is the extra with the gold, which adds almost another 7,000. Well, there's a discount program with Classic Crown. And for ACA, again, it varies by formulary. So major medical and ER, cost sharing after the IUA, which is nothing more than a deductible, no annual max. Again, the 2,500 deductible or the 1,500 to the 5,000, whatever you choose. As I said, we're in a 2,500. That's it. After that, there is nothing else. On Classic Crown, it resets per incident and there's unlimited exposure. That can get pretty scary. On ACA, at that point, there are maximums that do apply. We really got to look plan to plan to address that. Faith requirement, there's none for ours. Christian faith statement required for Classic Crown and none for ACA. I do want to point out that we don't make you include a faith-based statement, but this plan is actually built on a Christian share platform. Now, aging out. This is a crucial, guys. For aging out, there is no age out with our program. So if you get in before you're 65 years old, you can stay in, period. Now, they cannot enter the program after 65, but before 65, you can get in and they do not kick you out, period. For Classic Crown, membership ends at age 65. And ACA, there's no age limit. But I want you to remember, we keep talking about ACA over here to the right. Those are the $1,900 and up plans. So keep that in the back of your mind. But again, with us, no age out. Annual admin fee, we have none. For Classic Crown, it's $45 a year. And for the ACA, there's none. So taking that, I want to introduce you to one more testimonial. And little hint, this is somebody that's actually affiliated with you guys. We had clients, Angie and Sierra. When they came to us originally, they were locked into paying $1,717 a month. Well, we sat down, we went over the social health plan. After that, they are now at $1,134.97, a savings of over $600. Guys, I don't know about you guys, but $600 is a lot of money when you're looking at your monthly budget. So just imagine what you can do for the average family. I mean, it's incredible the opportunity, the doors that this opens. Now, why social health wins? Guys, these are just a few of the reasons that associates are able to sell more deals. Like we said, there's no faith requirement, no annual or lifetime max, true prescription coverage, not just a discount program. The MEC compliance, the ACA MEC compliance again at tax time, the unlimited virtual care, and pre-existing can get assistance day one on certain programs. Like Stu said earlier today, we're going to have to cap this at some number. He could come up with 20 or 30 reasons why right off the bat. And we capped it at this. There are unlimited reasons. Your ideal prospect. Remember when we talked in the beginning, guys? The product that you had originally was designed to be an overlay, something that gives assistance, gives a little comfort if they don't have anything. Well, guys, your market, who you can sell to, has just absolutely exploded. Think about how many people we've talked about. Upwards of 30 million people have lost their subsidies. Guess what? They need you badly. Self-help workers, gig workers. Guys, this package that we're delivering typically is not able to be delivered unless it's an employer plan. We are the first group that was actually approved to deliver these products outside of a business plan. So self-help or the self-employed people, absolutely. Gig workers, absolutely. Family seeking value. Guys, again, we've talked about the people that have been paying ridiculous amounts. They're struggling to make that payment. There's a whole lot of people out there that would cut their expenses greatly by this product. And health conscious individuals. Guys, there's so many people that have already invested in their health. A product like this is just going to give them that extra layer of coverage and comfort that they need. Now, we've talked about the free benefits quite a bit, guys. I get really excited about this part because when I first looked at this, again, not being from this industry, I thought, oh, well, this is preventative stuff. Okay, that's great. Well, when we started to go down the list, let me read some of these to you guys. For children, meaning from birth to 18, all of these are included at zero cost. So, newborn screenings, blood, hearing, sickle cell, well baby and well child visits, autism screening both at 18 and 24 months, vision, behavioral, developmental screening, and the list goes on and on. For adults, blood pressure and cholesterol screening, type 2 diabetes screening. I always have a hard time with this word. This word. We joked about that a lot today, didn't we, Stu? The colorectal cancer screening. So, guys, when you get my age, there are certain tests that you have to do to prevent anything. All of that is free, literally no charge. HIV and STI prevention counseling, lung cancer screening for high risk individuals. And that's just a few. On women, mammograms every 1 to 2 years for people 40 and above. They're free. Pap test, cervical cancer screening, BRCA genetic test counseling, bone density screenings, contraceptive coverage, and prenatal care. Guys, they're literally free. When you see the list, it blows you away how much they have invested in keeping you healthy. Almost sounds crazy under the medical system that we've been under. It's almost like they want us to be sick so they can sell us something. With this program, they're actually keeping us from getting sick and giving us free options to be able to prevent from walking down that road. Now, when you're talking to people, there's some things that are going to be said on a pretty consistent basis. Remember, a confused mind asks questions or says no. That's an opportunity to really explain to people exactly what we have. First of all, this isn't real insurance. You're doggone right. And that's the point. Traditional insurance has priced 27 million Americans, and remember, actually 30 million, completely out of the market. Well, the social health program is a benefit program that's ACA Met compliant on gold, platinum, and real RX coverage. So you're right. It's not real health insurance, and we're excited and happy about that. What if I have a major medical event? Well, that's exactly the program that we've designed. The Core Plus programs, those are the ones with the deductibles anywhere from $1,250 to $5,000. That's exactly what that's built for. We've got that covered. I have a pre-existing condition. Guys, this opens the door for a number of conversations that you can have, and you can still benefit these folks. And keep in mind, on the core program, pre-existing doesn't matter. And on the plus program, we still phase them in. We can still give them an awful lot of coverage. How is this different from other health shares? Well, we've talked a little bit and we went head to head against the next largest competitor, but there's no faith requirements, no $1 million lifetime cap, there's unlimited virtual PCP, which is the primary care, and mental health visits, $0 for the virtual visits, real prescription coverage. It's very different from other health shares. But again, guys, these are just opportunities for you to explain to people exactly what we have and how we can help them. So the market has truly never been bigger. When I looked at this in December, I remember thinking, this is a tsunami. I remember thinking, this is going to be terrible. But in reality, now that we've put this together, this is a huge blessing because there's still that tsunami of people who need us. It's getting bigger and better every day, or bigger and bigger every day. Remember, we talked about an extremely large amount of people have yet to lose or give up their coverage. So there's more coming. It's never been a better time to have a product like this in your arsenal. Now, we talked a little bit about the customer service. Again, I can't stress enough the member services line. Guys, that is your lifeline. Use that for any question at all. Again, we meet you where you are, get you where you need to go. Doesn't matter what the question is. And believe me, I've tested this several times. And I think you're going to be blown away. Whenever you hear that social health on the other line, it's going to make you smile because you know you've got an army of people who are backing you. We encourage you to take a look at the website, xosialhealth.com, review the plans, and you can actually start your enrollment today. Now, I want to give you one more testimonial. This guy you may or may not have seen before. This testimonial is actually near and dear to me. Over the last year, Stu and I have become very close friends. And when we began to look at his, I was determined that we're going to make a difference for Stu. Stu was, before him and McKenna, he was looking at $1,974.29. Stu's plan now, guys, is 1134.27. He's getting more coverage and better support and significantly stronger customer service. So I'm really proud that we were able to help this guy.
Hey Jay,
Yes.
don't go wait, go back for one
Yes.
minute. Go back.
Okay.
I was really good. I was going to interrupt you 10 times because I'm so excited about what's going on because I've kind of got to live a lot of this with you. But right here, and folks, we're almost done. Just 5 more minutes, okay? And we'll wrap this up. Um, I just want you to know how crazy this is. I was excited about the savings, right? I'm like, man, almost $900 a month. I mean, or $800 a month. This is nuts, whatever, something like that. And I'm all excited. And then I'm like, hey, but wait a minute. And that $1,134.27 is fully commissionable. We're putting a chunk of that into the compensation plan. I'm thinking, oh my gosh, it's even better because now the families here make money off of all of us being our own customers and going to get a bunch of people that need this out of 30 plus million people, right? And all that. And then I was like, this is so exciting. This is great. And then something happened that trumped it all. Trumped it all. McKenna came up to me and said, Dad, because we've been getting blessed to test this for months now. And she came up to me and she said, Dad, I am so sick of our regular insurance. And what you have is the best thing I've ever had in my whole life. Dad, I just called up and in 15 minutes, a doctor called me back. He listened to my symptoms. He's like learned all the. He said that's viral. You're gonna need antibiotics for this one, okay? Because it's this crazy thing that was going around. And he said, no problem. I'll call them in for you right now. 15 minutes later, they were at Costco by our house. She goes there, she gets them, and it's free. It didn't cost us anything, right? And she's like, Dad, this is the best thing ever. Then she used our $1,974 a month plan. And she's like, Dad, it cost me $175. And I go, yeah, you got to pay that yourself, young lady. And it was crazy. Right? So I'm just telling you, when you experience the difference of how you live life out, owning this, having this in your life, Jay, it's real. I mean, it becomes real. It's crazy. So remember this, everybody. One, we're saving people a bunch of money. Two, it's going to put a bunch of money into the comp plan. And three, they're going to like it better than what they have now. That's how nuts this is, right? And you can do this anywhere in America. The whole United States is covered. And those of you that might be watching this in other countries, you may know someone in America. You can help them right now. Imagine if you get paid every month when they pay for their health plan, right? That's what we're talking about. So this is another very exciting room in the house, and we'll see all around the world someday. But for right now, everyone, I just want you to know we're in pre-launch though. So Jay, go ahead and click the next one. Jay, thank you so much. Great job sharing all that information. Everybody, and if you heard pre-existing condition, I can't do this. I want to make sure you know that's not what Jay was saying. A lot of plans, if you switch them and you have a pre-existing condition, you got to wait 2 years before they'll cover that for you. Here, it's like a year, so it's like a year sooner, and it doesn't mean you still can't get the rest of the coverage. And some pre-existing conditions, they waive. They're covered right away anyway. Okay, so that was the one question that came up a few times for me, Jay. So I just wanted to recover that. But everybody, look, I just got to say it, Jay. Thank you from the bottom of my heart. I had no idea 6 months ago you were going to basically take over the company and turn it into all this. I was just like, can you help fix this little plan that we have? I didn't know we were going to have a total solution for America, right? I mean, this is awesome. And everybody, see the word at the top, pre-launch, pre-launch, okay? Tonight, we're taking the coming soon off of the room in the house. So this is what you should do next. Write these two website addresses down right now, everybody. You should become a social health T1 agent. Okay, what is that? So, everybody, in case you haven't caught this, even the customer support is branded for Social X. They're going to answer the phone basically Social X or Social Health. Both of those are Social X. Okay. Social Health isn't Jay's company's division. Social Health is our division. It's our room in the house called Social Health. So go to socialhealth.com/socialx/sign up. Okay, write that down. Socialxhealth.com/socialx/sign up. It's free to become a T1 agent. That's a tier one agent. That's all that is. Okay. That means you're going to be basically licensed to sell this. Okay. You don't need a physical license, but it makes you eligible to sell this anywhere in America. And here's the neat part. You don't have to be the salesperson. You're going to send them to the next website that I'm giving you right now, or let them call the toll-free number, and a licensed insurance agent will take them through everything and figure out what their family needs. What am I saying? You can basically refer people to the toll-free number and make money. That's what we're talking about. When I heard that, I was like, Jay, are you kidding me? He said, Stu, they're even going to answer the phone Social X or Social Health. Now, folks, this isn't our in-house call center, which you have for free. This is just for this one product. The health plans, this is the customer support that's yours for free. And there's agents there to take care of everybody for you, okay? So first thing you want to do, if you want to sell the product in America, you want to sign up and be a T1 agent, a social health T1 agent. It's free. Go to that website, just sign up. The second thing you're going to want to do, everybody, if you want to get the product like we have it, McKenna and I, and all of us here, if you want to do that for yourself, you'll go to socialhealth.com. Now, you're going to give out, remember what I said, we're in pre-launch, okay? All of this is going to change over this next week, basically. You're going to see a lot of stuff happen by Monday-ish, Tuesday, Wednesday, but there's something very unique that's going on right now, so we had to pre-launch this today, and here's what it is. This doesn't have a you got to wait for open season once a year or open enrollment once a year program, but it is everyone that signs up by the 24th of the month starts on the 1st of the next month. Okay. Well, we're sitting here on the 21st and we were going to launch this next week. And then we're like, whoa, the enrollment closes on like the 25th, basically. Okay. The 24th, 25th of the month for next month. So Jay's team is actually going to extend that for us to about the 29th of the month. So that means if you have anybody that wants this right away and they go in and get signed up for it, their coverage is going to start by the 1st of next month, everybody. So Jay, thank you for extending that just for us. Okay, that's awesome. And I'm trying not to forget anything, everybody. You're going to have stuff in your Social X back office tomorrow. You'll see in there links and everything. Okay, tomorrow afternoon. But for right now, you can go to socialhealth.com and you can see your plan, get your quote, and get started. You can buy this if you want right away. Next week-ish, you're going to be able to send people to socialhealth.com/your username. Like I'm Stu here at Social X. It's your Social X username. So I would use socialhealth.com/Stu. You would use whatever your username is. You know that. And then that will track everything. Okay. But for right now, don't worry. If you send people to socialxhealth.com, socialhealth.com, and they get started, they're going to have your username. You can tell them what that is, and they'll get taken care of. All of this is getting figured out in the next several days. The reason why I didn't get on here right now and announce, okay, everybody, this starts next Tuesday night, is because the grace period that they're giving us is wonderful, but it closes out by the 29th of the month. and I wanted you to have all of next week to go sign people up so they can start on the 1st of June. Okay, everyone. Jay, I don't know if I just missed anything or forgot anything. Is there anything you want to add to that?
I think you covered everything. I just, again, I want to thank you guys for the opportunity to partner with you guys, team up, and make an impact. I've always said that when it's all over, I want to be able to look back and say that everybody ate better because I was at the table. So I appreciate the opportunity to partner with you guys and make an impact. Thank you.
Jay, thank you so much, buddy. I appreciate you more than you know. Thank you. Everybody, we're not planning on being in pre-launch for very long. We just didn't want to wait and have everybody start the 1st of the next month. We wanted it to be this month coming. So just bear with us. If you have any questions, you can call that toll-free number. Jay, can you pop that back up so they can write that real quick? Okay, everybody, if you have any questions, go back maybe one more. Let's see. Okay, I just want to give them another minute. So there it is, 1-855-282-5700. And remember, that is your Social X customer support that is at this company for our social health plan. Okay? So 1-855-282-5700. Everyone, I appreciate all of you. This is another really exciting room in the house, and we're going to get it completely organized and ready to go. But because of those time constraints, we wanted to give everybody a shot to start on the 1st of June. Okay, everybody, appreciate all of you. Jay, thank you so much. Take care, everyone. We'll talk to you
Thank you,
soon.
guys.